Hey, everybody, and welcome to the Hardyburg Internet Broadcast Network right from the state-of-the-art studios here in Round Rock, Texas. And Dr. Dan Bachelor's laughing at me because it is. It's got glass walls. It's huge, right? It's
Golden microphone.
going. Yeah, it's got the golden microphone. We can't steal that from that guy, can we? So anyhow, hey guys, welcome back. Took off quite a time. Let's see, I took off 2 weeks before Christmas and the first week of the month. And so we're back, and this is show Dr. Bachelor. This is show number 108. We're going into our fourth year of broadcasting, and we have over, I guess, close to 108 archive shows that people can go back and listen to archive business. So it's kind of cool. So if you're listening for the first time, you will notice that there's no video showing on the YouTube channel. Well, that's fine, because what we do is we broadcast like a regular radio format out over the channel. So we got the message out today. So if you're checking us out or bouncing in during the show, thanks for being here. But what we do is we cover local Austin business. I have 11 sponsors who pay for 20 shows, and then they re-ante up. And because they pay the sponsorship fee, it allows me to bring on guests like Dr. Dan Bachelor so he can have his own show. And what we do when it's over and it's on YouTube, not only is it on YouTube as an archive, but I go out and build a custom player for his business so that he can put it on his website and share it in his newsletters. And so we'll keep it very generic. We've got our crack staff our producer came up with about 5 to 10, about 10 questions?
Yeah.
We came up with 10 questions, and tonight we're going to talk about chiropractic care, and you're going to love this guy. He's really good with folks. I've been in his clinic, and it's awesome what he does for folks and how he helps them. I've sat through quite a few testimonials with him with clients, and they all love him. And so we're going to have fun tonight. But before we get to him, I want to thank a few of these guys. Right. I want to thank Danny L. Smith. Danny L. Smith is John Maxwell certified coach and one of our sponsors. You can find him at DannyLSmith.com. As a matter of fact, he just started a 12-week sales marketing boot camp, which I'm doing every Monday night from 7 to 8. It's a webinar on phone, and we really dive into the sales funnels, the change of mentality, the mindset for a person. So if you're interested in picking up a coach this year, which I tell everybody, Dr. Dan, maybe, is that somewhere in your business career, you're going to need somebody to help direct you through some issues or some things you're doing, right? Whether it's your business or personal. And so I tell everybody you're going to need a coach. So go check out Danny L. Smith. He's a John Maxwell certified coach, and right now he's offering a fantastic marketing program or a boot camp, and it's just really, really good. So anyhow, all right, next. Mike ONeill is a buddy of mine, and Mike ONeill is also a coach, but he's a different kind of coach. He's a money coach, but he travels all over the United States and does speaking engagements for an organization, and he helps couples. He helps younger couples get started with a real budget. And so go check out his website. The easiest way for you to find out what he really does, because he's got his hands dug into a million different projects that he does in the speaking realm, go check out mkoneill.com, mkoneill.com. Okay, thank you, sponsors. That's 2 of our 11. We won't get to all y'all, but y'all know you're linked on the custom player, so it's all good, and we give you a link to your website. So thank you. Just like real radio, isn't it? All right, so I'm sitting here tonight with Dr. Dan Bachelor from Bachler Chiropractic, located in Pflugerville, Texas. And for those of you listening from Russia and France and England, or will be listening to this, yes, Pflugerville is a real city. And it's spelled about as funny as it sounds, right?
Yes.
All right, so you brought a bunch of questions to me tonight, but before we do that, I have to get you kind of loosened up with some personal questions.
Sure.
So these are trick questions that you weren't prepared for.
Okay.
All right, so favorite color
is red.
Red, right? Okay. Favorite band.
Favorite man?
Favorite
band.
Yeah,
oh,
favorite
okay.
band.
That would have to be Boston.
Oh yeah, yeah. Oh yeah. Who can? you know, when they came out in what 1977 was
Yeah, I
their
think
first
so, yeah.
launch, right? Everybody, when they heard their first song on that album, just stopped their car
That's
because it
right.
was so ahead of what we'd been used to hearing, you know. So I love Boston,
Yeah,
right?
I had them on 8-track, I think.
Oh, yeah, or you had them on the plug-in eight
Yeah,
track. Oh
yeah.
yeah, oh yeah. Mine was at that time, and it's earlier guy than that was when Joe Walsh was with the James Gang
Uh-huh.
back when he first started.
Yeah,
So you know, but Boston, oh man, they rock. Okay, so
yeah.
was that the last concert you went to too?
No, I never got to see them.
Last concert?
It was probably 38 Special.
Mm, wow. And
And Eddie Money.
I'm not going to even
And
ask
Eddie
you how long ago that was. Was that recent or back in the old
No, no,
days?
that was back in the day.
That's awesome. All right. So did I loosen you up enough?
Oh,
And
yeah,
how
okay.
long have you been in Texas?
Was raised in Georgetown, graduated Georgetown High, class of 79,
Holy
when
smoke.
disco was king,
Yes.
and then moved away for about 30 years and just got back here about a year ago.
So you missed it.
Yeah.
Now, Austin was so totally different.
Oh, yeah.
I mean, Georgetown was just a blip, and Round Rock was just a blip. Matter of fact, that was a long drive to have to go up there,
Yeah.
right?
Pflugerville was a dot, I think.
Well, it was. And you know that the second largest city is in Travis County, right?
No.
Pflugerville.
Pflugerville, really?
Because
No.
it is. That was one of
Wow.
those trivia questions the chamber asked one time at a luncheon. What is the second largest city inside Travis County?
Wow.
Everybody went, what? Pflugerville. See, now you got a new one.
Wow. I'll use that tomorrow.
There you go. All right. All right. So tonight we're going to talk about chiropractic care. And the beautiful thing about this is if you guys don't catch this tonight and you hear this another day on his website or wherever he decides to put the links to it, you guys are going to get great information to know exactly what he does, right? So first of all, how long have you been practicing?
I am a graduate of Cleveland Chiropractic College in Kansas City, Missouri, from 2012. I've been practicing going on my third year.
And that's awesome. And a lot of people still, I know this is funny, and I know you hear it all the time. People are still confused about what is chiropractic work, right? And I'm going to let you answer that, but it's amazing. You go up to people and they still don't understand what a chiropractor is,
Yeah.
right?
Yeah.
So how would you define it?
Chiropractic is using your hands to be trained to use your hands to bring healing and bring to reestablish proper position and function of a joint. And chiropractic was, I guess, discovered in 1895 by a fellow named D.D. Palmer. He was the very first guy to implement that type of healing. And it has developed and evolved, if you will, over the past 100 and some odd years to where it is today. There are over 70,000 chiropractors in the United States that practice all over the world, actually.
Right. And so it's evolved, obviously, right? And we can talk more about techniques and things further into it in your questions, but you threw a term in that question and you made an effort to remember to say proactive. So what is proactive care? What is reactive care? Because I imagine that's what we go through, right?
Right.
When we come to see you.
Well, you can be proactive in many phases of your life, or you can be reactive. Reactive is as far as your health care is concerned. Reactive is you're going to wait until you get a fever. You're going to wait until you're,
you can't move your neck or you can't bend over. Right.
I get people all the time telling me, Doc, I was putting on my sock and I threw my back out. How did that happen? And I say, well, it wasn't the sock. It's something happened earlier that you don't quite remember.
Right.
And it was kind of the straw that broke the camel's back, if you will, pardon the pun.
Right.
But that is
no pun intended.
Yes.
Okay.
Chiropractic is we strive to be proactive. In other words, we want to be preventative. We want to take steps through our healthcare and through our diet and through our how we think about wellness. And That's how we strive to be proactive. We want to be preventative, and to be preventative in the long run saves you money. It's easier.
Yeah, you don't have to come in and get everything done at once
Right.
and go through hard struggle. And you're right about the money thing. I mean, obviously, if you're out in front of something, right, then you don't have to always worry about it picking up the sock, and you can't
Right.
stand back up straight again forever, right? So that's good. So all right, so proactive, reactive. Now is how effective is it?
Chiropractic is effective. It depends on the patient, how committed the patient is going to be to care. With it, we don't rely on pharmaceuticals that may have bad side effects or bad reactions. We want to. I kind of liken the effectiveness of chiropractic to climbing a mountain. If you climb a mountain and then stop for too long a period of time, you start kind of losing ground. Then you have to regain ground that you've already gained. And so chiropractic has been found to be very effective in treating low back pain, in treating all your joints. In fact, it's been found to be effective in other more organic treatments because our muscles will spasm and pull against something else. It'll cause muscle pain or headaches, and to get your body in proper alignment will bring the body into its full function and be able to function at its highest level. And if we are able to function at a higher level for a longer period of time, it's going to improve our performance in whatever arena we are in, whether it be athletics or sitting at a computer, typing, or whatever we're doing. If our bodies are operating at a maximum of efficiency, we're able to perform better for a longer period of time.
Yeah, and I know for a fact that severe neck pain, where your blood vessels run down through your neck, right, and heart, can affect your overall health. I mean, these things can affect your health.
Oh, sure.
Drastically, right?
Yeah.
It can increase blood pressure. There's all sorts of reasons to keep your body aligned, right?
Right. A very simplistic way to look at it is our brain controls every cell in our body through electrical impulse. Now that signal can be interrupted or reduced. A very simplistic explanation is a water hose. If you are out watering your tomato plants and your ornery spouse comes and steps on the hose and reduces the flow of water every time you're trying to get out and water, the tomatoes aren't going to produce like they should. Now they're not going to die that day, or they're not going to,
right.
They're not going to stop producing, but they're not going to produce the big plump tomatoes that we're looking for,
because they're not getting the water,
because they're not getting the right amount of
right.
nutrient.
And I love that description, because that's really it, right? If you get blockage in these areas, it affects your health, your joints, and so okay, cool. So techniques. I know I haven't gotten into this. I want to check ahead to our crack questions here. Don't worry, we're going to stay on this page, but I'm going to have some other questions for you. Okay,
Sure.
Good. All right. So a lot of people want to know, Dr. Bachelor, that these they want to know, why do I have to come a bunch of times? Why the heck is it kind of like I have to come 10 times or 5 times? So a lot of people ask that question, don't they?
Yeah, they do. And what I tell a lot of people, kind of tongue in cheek, well, as long as you have a spine, you need to come see me. And
that's good.
we live in a time and an environment that is constantly changing, whether it's weather or seasons, or your kid left the Legos on the floor and you stepped on them in the middle of the night trying to go to the bathroom.
Sure.
And we live in a very dangerous environment. So one of the reasons we will see people multiple times is we want to create a rhythm in our treatment. We want your body to recognize the position that it's supposed to be in, not the position that it's currently in because of injury or trauma, spasms, etc. We want to establish that rhythm to have our bodies accept where we're supposed to be, not where we are.
Yeah, and that's you made a very unique point one time when you said that, and I thought about that after I left your clinic. You were saying that you help reposition the body to where it wants to be or supposed to be. Is that mean? And I was thinking about this. Does that mean that the pain we're feeling is the warning that the body's not where it needs to be? Because to me that makes sense.
Yeah,
right?
that is
because the body's trying to go back to its normal self, and so it can't. So it's sending you a hello.
Yeah, hello. I'm hurting. Yeah, I'm not in the right place. Our bodies will adapt to our environment, whether that's good or bad.
So you can walk bent over if you don't take care of it. You can get stuck with a lean in your neck from one direction, or a shoulder can always hurt, or a knee, or ankle, right?
And there's a law called Wolff's Law that tissue under pressure will grow. And so it's kind of like going to the gym, working out your biceps. That's putting pressure on the bicep. It's going to grow. And so if our spine gets into a bad position, I'm sure, Herdy, you've seen people, and the listening audience, I'm sure, probably knows somebody that is literally over time, they can't stand up straight anymore. You've seen the little old people that are kind of
as they get older, their back
and their body has actually grown bones. The bones have grown to support that bad position.
And the muscles and the fascia and everything else around it, right, just accumulates to protect the body, so it does what it needs to do to adjust, right?
That's right.
Wow. And so preventative, again, we go back to that second question, right? So these devices today, I'm guilty, but I don't do it while I'm driving. Thank you. Hello. Yeah, Rusty's late. Oh, we got a good boy down here, don't we? We're looking down, head down, like this all the time. And when we have our tablets out on our desk, we're looking down like this. And I know that the last thing you really want to get between here and where it connects to up here, and I don't know the term language, is you get that bow over a period of time, and your neck ends up getting twisted down, and you hurt right back in here, right?
Yeah.
So I would imagine you're going to be in good business for a long, long time because of these devices we have today, right?
Yeah.
They're wearing us out, aren't they?
They've termed it texting neck.
Texting neck, is that the new term for it? Okay, I hadn't heard that before, but I got it. So texting neck would be head down.
Yeah.
And so what would be a test if somebody can't, what is full mobility to be able to go all the way back, all the way to the side, and without
you should be able to turn your head 90 degrees
without you getting the pain running down the shoulder here.
Right.
Okay. All right.
And you should be able to look up.
You should be able to turn your head 45, 50 back degrees, like that, right?
And lean forward. I think almost the same amount, but
it doesn't hurt to exercise them and keep them strong, right?
That's right. Yeah.
All right. So on average, and then I'm going to dive into some of my questions for you tonight. On average, what does you get somebody set up, they come in, you do their assessment with them, right? They go through their Q&A with you, and you sit down and visit with them, right? And then they get into your program. Generally, how long does an appointment take when a client comes into your clinic?
Initially, there is, of course, the ever-popular intake paperwork that a patient has
to do it, right?
Which you can go to my website, Chiropractic.com, and download.
Oh, yeah, we need to talk about that.
And download the information and then bring it in with you to save a little time. But the actual exam, x-rays if needed, will take about 20 minutes or so. And then the second visit, where I give the report of findings and the consultation aspect of the exam, and we'll review what I want to do, what it will cost, go over those three things, how long it will take. That takes about 10 minutes, but generally an established patient, they'll come in, it'll take 4 or 5 minutes to be in and out of the office. And it's fairly quick, and
Because if
doesn't
they're
take
on a
very long.
proactive program with you and they're coming in and doing the maintenance, right, then you don't have to spend a lot of time after you get through the assessment with them because you're working on very specific stuff with them. So it doesn't take long. They can be in and out. So the cool thing about what I'm trying to get people to realize is let's say you work during the day and you need to come see you at lunch, right? Well, if it only takes 15 minutes, they still got 45 minutes worth to go back, still have time to eat and can come see you, right?
Right.
So that's a good point. I'm going to link his website on the Custom Player and on the YouTube channel. But if people want to go visit your website tonight, where should they need to go?
Go to www.bachlerchiropractic.com.
And Bachelor spelled?
Bachler.
And then chiropractic, all one word.
All
Go
one
visit
word.
their website. Don't leave our show. You can always go check it out. And they've got everything. By the way, the website's got everything. It's got neck pain, joint pain. It's got back pain. It's got pictures. It's got descriptions. It's got videos. So it's a really well-designed site for you that's getting implemented so people can go read everything they're experiencing. All right. So I was an athlete in college. I'm guilty. So I sat in center field, and some days I'd just roll my neck and pop my back, or I'd pop my shoulder, or I'd pop my ankle. Is that something we need to be doing?
The issue with self-adjusting is that it is very general and non-specific. As a chiropractor, I want to be as specific as I can in adjusting and not just wailing on every joint in your body. I want to be very specific in what I do. When you adjust yourself, you can cause more harm than good many times. If you use your hand on your chin to pop your neck,
oh, good. I don't know.
You can
Hurt yourself.
hurt your jaw, and that can cause headaches. It can cause migraines. That TMJ joint can become inflamed and just cause all kinds of issues. But the biggest deal is it's non-specific, and we want to be as specific as we can in treating our patients.
And what are some of the common things that walk through the clinic door? What are the most common things that you deal with that you're seeing on a daily basis?
I see low back pain definitely every day. That's the most common issue that Americans face. There are over, I think it's 7 out of 10 people will experience severe low back pain throughout their life.
Wow.
And we are back specialists as chiropractors. We have intensive training, many classroom and clinic hours devoted to specific anatomy classes, radiology classes, neurological classes having to do with the brain and the nerve system, and how all those things work together.
Now, one of the questions I have that's not on this list that we have is when somebody comes in for the first time, obviously you're going to have to take some pictures, right, to see what's going on. I mean, it's just part of what you have to do. You need to see what it looks like and kind of get a inside view of what's going on, right? And so x-rays are part of what you have to do, correct?
Right. I want to get as much information as I can so I can make the best diagnosis that I can, so that in turn I can pass that information on to you, the patient, and the patient can make the most informed decision that they can with their health care. If I can't see what's going on inside, I'm kind of guessing at that point. And so I want to be very specific in what I do different orthopedic and neurological testing to prove or disprove issues that may be arising in your body.
And also insurance. Do people, when they come in, do most insurance companies, do you find that a lot of that's out of pocket from the individual, or a lot of insurance companies lenient toward ongoing care with you?
Well, everybody is different. Even within the same insurance company, we have choices we can make, higher premiums, higher deductibles, or higher copays. We just have to get the patient in and call their insurance and find out what they're going to contribute. And some have limitations on how many visits, on what kind of treatment they can receive, number of treatments that they can receive. And We just have to. It's an individual basis.
Right, but you have packages you can present to people too yourself, right? So they can come in and get on a long-term maintenance program with you, and you have packages
Correct.
you can show
we'll
them.
we'll make it affordable. We'll
Yep.
make it fit your budget, and get you back on the road to being healthy.
All right, so here's the big question I have. I've been to a lot of chiropractors over from playing sports. We were using chiropractors, and you know this, back in the whatever those techniques were back in the 70s, because when you played sports, you played 2 baseball games every day in college, you had to have both massage and this chiropractic to keep you where you could actually get out and function the next day, right? And some used to twist and pop, and or turn, pop it and pull your leg and pop it out. So do all chiropractors treat everybody the same way, or are there different ways to do this?
There are over, I looked this up today just to make sure I was fairly accurate. There are over 120 different named techniques, and that's only the named ones. There are chiropractors that are more aggressive, if you will, in their adjusting. I was taught and believe that a gentler touch is more effective. I can my sensitivity, how I feel the patient's spine, for example. A light touch I believe can feel better out of position joint than just a very hard motioning of the joint.
Right.
And but there are many techniques. Overall, I believe they are all very effective in their different ways. And I myself am trained in about 5 or 6 different techniques through school and through different classes that I've taken to adapt my treatment to what the patient needs. I don't want the patient adapting to me, but I want to adapt my treatment to what the patient needs. And that's what kind of comes first in my office is I have a patient-based paradigm in how I treat people.
Yeah, so those techniques are all different. And so people should feel comfortable with whoever they think's got the best technique, right? But I know from being in your clinic, I've seen what you do, and I'm telling you guys, if you live in and around Pflugerville, around Rock, whatever, you need to go see Dr. Dan Bachler, because I'm in there quite a bit, and I see what the patients are saying when they come in and when they walk out. They love this guy, and they love how he treats them. So, and this gets me into my next question, which you don't have on here, and that is age groups. What can you treat?
I've treated a baby that was 3 days old.
Yes, you did.
And infants' birth is a very traumatic happening, especially if there's lots of pulling and twisting to get the baby out of the birth canal. It can be very traumatic to the baby and the mom.
Right.
And so I've treated babies or infants with colic, with torticollis, which is a spasming of the neck where it just pulls it over to one side or the other.
I can feel that already. Stop.
And, I've treated a patient that was, I think, 96 years old, was the oldest patient. And everyone in between, every type of patient, athletes. I've treated pro football players. I've treated basketball players, marathoners, triathletes,
average work person,
average
their
Joe,
computer all day long,
collar,
right?
White collar,
does my neck's killing me, and just our weekend warriors, right? That are over 40 that think they can go run like they're 20, right? Yeah. So, hey, how is this is just a personal question from me. How is muscle, joint, and all this stuff connected? What does the muscle work against the joint, or does the joint work against the muscle, or is it both?
Well, the leg bone's connected to the foot bone, and the foot bone's connected to the toe
right.
bone.
Okay, I remember that. I played operations.
There is a kinetic chain. Our skin being the outermost.
Right.
Beneath that is fascia, which is a tissue that separates the skin from the muscle, and also muscle from muscle. It gets down to ligaments and tendons, and then cartilage and bone, and all the different nerves that go through our body. Believe it or not, are an issue in your lower leg, the fibula bone. If that's out of position, it can cause low back pain.
Yeah, so the pain you're getting, this was another part, may not be directly related to where you're feeling it.
Right.
Where you're feeling it might be the end result of something going on elsewhere,
right.
correct?
Yeah. I want to find the root of the pain.
There you go.
I don't want to just chase the pain. I could adjust your low
Right.
back pain every day.
Right.
And it would keep coming back. And finally you would give up and say, hey, chiropractic doesn't work. This guy's adjusted me, 4,000 times and it still hurts. That's because we're not finding out why it's hurting.
Where the source is.
Yeah, and what the root of the problem is.
Yeah, because I know that sometimes I can have a knee ache from previous injury, but I won't feel it necessarily on my knee. I feel it in my hip because I've been favoring my walking all day, not
That's
realizing it, that just that little bit of off step started forcing you up through your hip.
Your body
right? And that's when I know my knee is upset, is when my hip hurts, because I've discovered where the source is. Even though I don't feel it, I favor it, right?
Yeah.
Something you just mentioned was really cool, and I'm intrigued by it because I've got somebody that's involved in that. But you being a chiropractor from the skin in to the joint, you just mentioned a word that a lot of people aren't familiar with, and that's called fascia.
Yeah.
And that's a pretty important part of our body, correct?
Right.
It holds our organs in, but it also can be a problem if it's overcoming an injury, right? It can grow and get bigger and accumulate on us, correct?
It'll form an adhesion,
like scar tissue, real thick and hard,
scar type tissues, that will adhere to either your skin or the tissue beneath it, the muscles. It'll cause muscles to stick together, and then they don't function as well. If you imagine a bungee strap that you've tied a bunch of knots in, doesn't stretch like the same size bungee strap that doesn't have any knots in it. And so if you imagine that happening to your muscles and the fascia they're not going to perform like they were designed to.
Sure. And so that's pretty cool. People don't know this term. I think they're just slowly discovering how important it is to the body, right? They've always just cut it out in surgery, and they didn't know that. So my next question to you is, we hadn't talked about your location. You're in Pflugerville.
Yes.
And you have hours of operation. What are those hours of operation for your clinic?
We are located in the North Forest office space complex. It's a really new complex. We are off Pecan Street or 1825 in Pflugerville, on Heatherwild, just one block north of Pecan, behind the CVS pharmacy. And
yeah, it's a nice, beautiful office complex. It's awesome. Yeah,
we are open Monday through Thursday from 9 to 1 and 3 to 6, and then on Fridays we're open from 9 to 1.
Yep. So you get to take some time off in the afternoon from the busy weeks you have. And so, all right. So the next thing I want to, you've got all sorts of things going on out there. You guys have a Google page. You have a Facebook business page. You're very active with your local Pflugerville chamber, which is a great chamber, really town friendly, right?
Right.
And what do they call Pflugerville with the friend thing? What is it? What is the, when they use the word Friendville, what do they call that? Pflugerville with the Friendville. Oh, never mind. We'll get into it. But anyhow, no big deal. I remember Jim Wilkerson used to tell me, give me some funny name for what they called that. But great Chamber of Commerce, very active in your community. You do a lot of events.
Yes.
And you've been known to wear a kilt to some of them.
Yeah.
Right?
Yeah.
Irish background, correct? Right. And all that stuff. All right. So typical people, if they want to set an appointment with you or come in, they can go right online, right? They can go right online tonight if they've heard this or they listen to the archive show when it's over. They can go to the website Bachler
Chiropractic.com,
and that's BACHLER, chiropractic, one word.com. You can schedule an appointment or you can call during the business hours and set up a time with them.
Right.
So what I missed? Anything you thought of you want to share on the show tonight, except just come see me and start being proactive with your health, start the new year.
If you're having issues, it's better to get treated sooner than later.
Oh, I was going to ask you before we get off some of the classic symptoms of what somebody might be going through with neck pain. It's side of the neck, shoulder. How about ears, hearing, ringing in the ears?
Yeah, you
Is
can
that
get
all part
ringing
of
in the
that?
ears. Yeah. There are specific nerve that come out of our bodies and go to specific areas. For example,
And you got one right here.
yeah,
Okay, good. Perfect.
The nerves that exit from our bodies at, for example, C6 or neck vertebrae, number 6, go to the neck muscles and the shoulders. Down in the thoracic vertebrae and number 3, it goes to the lungs, our chest. T6 goes to our stomach, for example. And if those areas get restricted, then you get our body trying to respond to that. You get GERD, gastro esophageal reflux.
Yeah, like all your antacids that you're
Right,
trying to take care of, right?
And our bodies won't digest properly. There again, it's the whole somebody stepping on the hose deal. Get off the hose.
Yep. And what's amazing to me is that the body is such a complicated thing, but yet in simplicity of what it works. You know, it's amazing that it's able to do what it does, but it lets you know when things are going on. If you know yourself well enough, you should have gut feelings about stuff, right?
Right.
You should say, hey, I need to get that neck checked because I'm turning that. As a matter of fact, we are going to set up time next week for me because I need to start this year because I am having those issues in my neck from editing and stuff. So I'm looking forward to doing that. So, all right. So website's bachlerchiropractic.com. I want to thank you for coming on. Very nice show tonight. We've been on almost like 40 minutes.
Wow.
It goes fast, doesn't it? And I want to thank you guys for tuning into the Hurdy Burke Internet Broadcast Network. And again, this show will be archived on YouTube. And I'm going to give Bachler Chiropractic their own custom player to put on their website. You can even embed it. I'll send the code just like Spencer's been doing with the videos, right?
Right.
And the best thing I would think is if they want to come in and work with you, because I know you get a lot of referrals in our network group. I mean, a lot of people are just talking about your practice and your service and how good you are at what you do. Encourage you to go to that website, Bachler Chiropractic, check them out, but call him. Just go in and sit down. He doesn't charge you to come in, sit down and say hi, and he'll give you a cup of coffee or whatever you want, and you can talk, and he's nice as can be, and they've got a really fine-tuned clinic over there, and they do a great job with their clients. I've seen the testimonials, so we know how good that is. So any final words? Did you have a good time? Was this tough?
Yeah, this was great. Thank you so much for having me.
It's no problem.
Yeah.
And hey, we'll see you guys around the corner. As a matter of fact, I have a Thursday night show coming up this Thursday night from 7 to whenever, 7:30, 8 o'clock. I'll be with one of my sponsors. I'm not going to tell you who. Just come check it out. I'll post it on the Facebook consulting page or the broadcast page. But if you are listening onto the archive after this show's over, I encourage you to go to the Hurdy Burke, and it's spelled HURDIEBURK network group on Facebook. I have a group page. I'll add you. It's public, and I'll be happy to add you. But that's where all the shows end up going, so you can listen to them in your car, listen to them, but don't be having the phone in your hand. Okay, put your ear. You have Bluetooth and obey the law in Travis County right now.
That's
all right. So we'll see you guys around the corner. Thank you, Dr. Dan. And we'll see you guys on Thursday night. Good night, everybody.